The following segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
We want healthy babies in Utah. We have Dr. Sean Esplin here with the Utah Department of Health. Utah just got their annual care for preterm birth grade, and it came in not good.
That's right. We got a C this year, which is worse than we've done in previous years. That's because this is the first year in 8 years that the rate of preterm birth has gone up in our state.
So we've done okay in the past. What's changing?
You know, I think that preterm birth is just a hard thing to prevent, and we've been really making a concerted effort in our state to try and address the rate of preterm prematurity, but we can still do better.
Okay, and one thing is, you said that Utah women might be having their babies too close together.
Yeah.
You need the body to heal.
That's right. You need to give some time between your pregnancies if you want to reduce your risk to wait at least 18 months between deliveries. That gives you the optimal chance of having a normal outcome.
Between deliveries or between pregnancies?
Between pregnancies.
Okay.
So from the time you deliver to the time that you become pregnant.
Okay, so these are some of the things you can do to try to avoid the risk of preterm birth. We have, like you said, spacing out the pregnancy.
Right.
Avoid multiple gestations.
Right. So preventing twins and triplets. So if you're on infertility medication, make sure you're being watched closely, that you're seeing someone who has experience with that. Making sure you get in early to your prenatal care before you're 12 weeks pregnant would be helpful.
Those checkups.
One of the biggest things is if you've had a previous preterm birth before, to make sure that you see your doctor before you get pregnant and have a plan for how to prevent a recurrence. The recurrence risk is 30% for people who've had a previous preterm birth. So.
And you might be considered high risk and they need to keep a closer...
Exactly.
What about progesterone?
Progesterone is the intervention that we use for women who've had a previous history, and it can reduce your risk by as much as 30%. And our best estimates that are that only about 50% of people who are candidates are actually getting it right now in our state. So people should ask their doctors what they can do to prevent a preterm birth if they've had one before.
Okay, just talk to your doctor.
Yeah, and bring it up the first time you see them. The earlier that we start it, the better.
Okay, and we know how many rules to follow. Get those appointments, talk to your doctor, and that just helps you avoid the risk.
That's exactly right.
Okay, thank you so much, Dr.